turn now to Greece, to Domna Michailidou, Deputy Minister of Labour and Social Affairs. Over to you in Athens.
Good morning from Athens, and a big thank you. Thank you for the initiative, thank you for the support, and thank you above all for making it happen. I've been a great enthusiast from the very beginning. Commissioner Schmidt knows it, I think, very well, and even more now, naturally being a member of it. So as Commissioner Schmidt said in the beginning and stressed in the beginning, investing in children is not just a moral obligation, but a practice that has clear short and long-term multiplier effects of social and economic growth, and should thus be at the center of every state's recovery plan. Now, they are the days that we're finalizing our very own in Greece Resilience and Recovery Fund measures. So it's certainly at the very core of my proposals and my suggestions there. The overall objective, this of committing uniformly resources, 5% as was discussed before, and as we all know in our practices, of structural funds to build a common framework and invest in the future of children, and thus in the very own fabric of our societies, is a practice that not we're just in agreement of, but we are strongly pushing forward. Our national objective is to achieve a spiral down dynamic in poverty reduction via mainly ensuring improved access to family and community-based care, support services, and inclusive education among children and young people in Greece, including children and young people in migration, children with disabilities, and children in institutional care. In Greece, being among the 7 member states that have been selected by the EU Commission for the pilot scheme, we consider this of great importance, both, if you want, symbolically, but also in the very essence of the impact of the Child Guarantee Scheme. Among the 27 member states, we are the only state to be exiting a decade of unprecedented financial and social crisis, which has had a severe impact on children's well-being, but also on the practices developed by our state to counter the negative income effects of the decade crisis. Through the initiative, the Child Guarantee, we have mapped very closely, and we have identified in great detail the needs for child protection in Greece, especially under the worsening of conditions since the pandemic broke out. Overall, the 2-year Child Guarantee Scheme program in Greece is comprised of 6 integrated pillars, which, so that for the economy of time, I won't describe them, but I can say that they are broadly divided in 2 streams. 1, DI, deinstitutionalization practices, and 2, the skilling and educational practices, which should be built to strengthen the individual, the kid itself. So we have been moving forwards, and in the first pillar, UNICEF has been of tremendous help to us towards practices for DI and practices for the strengthening of children's education. DI is a major pillar of the whole project. It's important to underline the adverse effects of the COVID-19 pandemic to our efforts. Seclusion and social separations have been increased due to the situation, contrary to our goals, and I'm sure that this is a practice that all of my colleagues in this Zoom, but also in the rest of the union are meeting. Because this means that DI has become even more urgent and even more major challenge which we must actively address. We have already launched a series of active policies to counter this effect. We have put in place a new swift and digitalized process for adoptions and foster care, which adds to the child protection by promoting transparency and also tackling irregular practices. See, for example, the selective adoption by each institution. Currently, we have 3,500 children in Greece placed in various types of residential institutions. Typical development kids comprise the smallest percentage of this. We have around 2,000 unattended migrant kids. We have kids with disabilities and quite a lot orphaned kids, which are at their teenage years, portraying, if you want, the failures of DI of all the previous years. We focus our actions concerning deeply institutionalized children, and we are working closely I must admit, very closely with UNICEF. Thank you, Ashraf Khan. Your Greek office is of tremendous help to us, and we have built a great team together. So with UNICEF, we are preparing a campaign dedicated to the promotion of foster care. So far in Greece, fostering has been the least popular choice among couples, mainly, I think, due to the severe misconception of its characteristics. In order to reverse the situation, apart from the campaign, we also plan to introduce the institution of professional fostering, mostly for kids with disabilities, and significantly increase the relevant foster allowances to help families with kids with expenses. The second of the actions that we have significantly progressed in, and this is my last point, I won't tell you more, is preschool education. And although preschool education is not directly included in the scheme, it's highly related to our goals, and it's one of the most important policies that we have already initiated as a Ministry of Labour and Social Affairs. In Greece, we suffer from one of the lowest preschool attendance rates. So less than 13% of ages of 6 months to 2 years old, compared to an average of 34% in the rest of the OECD countries, attend preschool education. We're thus responding to this urgent need to increase this share through two main tools. First, the increase in the quantity, i.e. state finance, and second, the increase in the quality of services provided. And this, as we perceive preschool education, of paramount importance. And this is because we know that that's why the child guarantee was also initiated. It's a child-focused anti-poverty policy where the beneficiary is the child itself. Second, it's a significant growth tool for building stronger human capital for our societies. And third, it works as an equality guarantee, since uniformity of high quality services in preschool education secures skills development and equality of opportunity for all children, regardless of their social and economic background. Our aim is thus to reduce inequalities and disparities in the development of children's cognitive ability, which seems to be diverging significantly according to the household's income as children move from the age of 6 months to 4 years old. You will see the delta there increasing significantly. So this year, we managed, despite COVID, to increase by 20% through national resources the financing of coupons for nurseries. And second, we're building reforms to the services provided through one, the formation for the first time of a curriculum for nurseries, a kit comprised of stimulating games, books, and activities for kids that ensures a quality floor in the level of services provided. Two, a mandatory and regular examination of children in order to achieve early diagnosis and early intervention for children with difficulties and neurological disabilities such as autism, something which is not done at all in Greece. And third, the reach out for parents' participation in the pedagogical process through regular meetings and suggestions for their own creative involvement with their children. So these are the two main pillars for the child guarantee that we're currently working on. We believe in them very strongly. We are very thankful for the common framework. We support it. And of course, we're looking forward to taking it even further. So dear all colleagues, thank you very much for this. Commissioner Schmidt, thank you one more again. Without you, nothing of this would have been possible. And Ms. Khan, a big thank you to UNICEF for all of your support so far, and hopefully from now on.